segment of Afternoon Live is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
November is Lung Cancer Awareness Month. What most people don't know is that there are many types of the disease and many different causes. Here to share more, we welcome from Providence Cancer Institute, oncologist Dr. Rachel Sanborn is with us today. Dr. Sanborn, thanks for joining us.
Hello, thank you for having me.
Spreading the awareness this month of lung cancer, there's many different types. Can you share what the most common ones are?
There are indeed many different types of lung cancer. As we tend to think about, there are a couple of broad categories of lung cancer, those that we call small cell lung cancers, and the rest are in a category we call non-small cell lung cancers. In that group of non-small cell lung cancers, which are the most common, there are many different subtypes, including what people may hear of as squamous cell lung cancers or adenocarcinomas of the lung, which are the most common type of lung cancer that we see in the United States. But even in those types of lung cancer, there are many different subtypes that behave differently in the body based on the different types of mutations that are in the DNA of those cancers.
Is the treatment the same for the different lung cancers?
The treatment for lung cancers are very, very different from each other. Back in years past, there were only very limited options for treatment of lung cancer, including surgery or radiation or chemotherapy. However, nowadays, as we have learned more about how to study the DNA of the different lung cancers and really understand that lung cancer itself is made up of hundreds of different kinds of lung cancers, there are different treatments that are used to improve outcomes for people based on those specific genetic changes within their lung cancer.
Can we share about the causes? My father-in-law passed away from lung cancer many years ago, and I remember it was always the first question people asked is if he smoked, and he didn't. And it was the shock in people, like, oh, wait a second, because you automatically think that someone is a smoker who gets lung cancer.
That's very true, and it's very unfortunate. And it is true that far and away the most common cause of lung cancer is tobacco use, either smoking or exposure to secondhand smoke. But not everybody who gets lung cancer has smoked, and it is a very stigmatized disease because of that, unfortunately. Other causes of lung cancer include radon, which is an odorless, colorless, but radioactive gas that is present in our environment and very common here, particularly in the metro area, but also environmental pollutions, exposures to heavy metals and other types of toxins can also increase risk of lung cancer.
What are the symptoms?
It kind of depends upon when the cancer is found. And the hard part is that by the time lung cancer causes symptoms for a person, many times that cancer is already very large or very advanced. So if a person is developing a cough that is not going away, or if they have unexplained worsening fatigue or weight loss, or they're coughing up blood, or they're becoming more short of breath, or they're having a new pain somewhere that is getting worse and not getting better, those are things that a person needs to be talking to their primary doctor about. And if a person is considered at risk, they may need imaging to look and see whether they have a problem in the lungs.
Is it easy to get screened? Who should get screened? Because I know people are probably sitting at home wondering, I have radon in my house or whatever it might be, and might have a little worry going on.
So the U.S. Preventive Service Task Force recommends lung cancer screening with a once-a-year low-dose CT scan for people who are between the ages of 50 and 80, who have had a tobacco history of at least what we call 20 pack years, meaning if a person's, for example, had smoked for a pack a day for 20 years, that becomes 20 pack years. If a person is either a current smoker or if they have quit within the last 15 years, those people should talk to their physicians about whether they are a candidate for lung cancer screening. Right now, there is not a clear evidence of benefit for screening for other types of environmental exposures, although there is lots of research going on, and hopefully over time we will have better tests.
So you're talking about the 20 pack. What about if you have secondhand smoke at that level?
So secondhand smoke has a little bit different level of exposure within the lungs. And right now, there's not a great way of being able to measure how much secondhand tobacco exposure equates for lung cancer screening. And right now, lung cancer screening is not recommended for non-smokers who have exposure through secondhand exposure. But if a person feels that they have had significant secondhand tobacco exposure, that should be something they should talk to their doctor about.
Now, you mentioned research. Can you share what new research is going on?
There's a tremendous amount of new research going on in lung cancer in particular, and of course for all different types of cancers. And that research spreads across all different types of areas of treatment, including looking at how we need to better apply immune therapies to help treat lung cancers and other cancers. Those are medications that try to help our own body's immune systems better recognize and attack the cancer that is hiding inside. There are also targeted treatments that specifically attack particular mutations within the DNA of the cancer and the proteins that they make to try to help shut down that cancer's function. There are studies going on looking at how we can better test blood markers for lung cancer at all stages, from before diagnosis all the way through, and also looking at how we can use treatments better even after surgery to try to help decrease the chance of a cancer coming back.
Dr. Sanborn, thank you for all this information.
Thank you. Thanks for having me today.
Yes, and we'll have more information on our website as well at KATU.com, but do not go away. More of Afternoon Live when we come back.